I'll start off with a smile this time. A few things to talk about. Thank you for all the messages. I haven't replied to them. I will do. But some of the questions I thought I'd just go over again. One of them was, who was it that told me I had 4 or 5 years to live? Well, it was Dr. Richard Schaffer. And if you Google him, you'll see he actually knows what he's talking about. He also said, of course, at that time that I may not make it till Christmas, and also that it could come back at any time with a vengeance, which is, yeah. So I used to label him, say it as it is. Well, he explained to me that at that juncture, men have 2 choices. They either take the medication, the anti-hormone treatment, which takes away the libido and everything, and as you've had a prostatectomy, it doesn't really matter anyway, but it does make you feel rough in many ways, as I've talked about before. Or, and some men choose this, that instead of living 4 to 5 years with the medication, they choose not to have any medication. And those generally are the people that haven't had the operation and are still intact, and they want to live a normal life for 2.5 years. But that's a choice. And I chose the 4 or 5 year route and the medication, because who knows what's going to happen around the future? You just don't know. I read this morning about the herpes drug being used to reduce cancers and actually removes tumours in people in end-of-life care. It's not prostate cancer, but it's another form of cancer. So you just don't know what's coming around the corner. So keep yourself alive as long as you can, because things could happen. And the other thing I've always said is exercise, exercise, exercise. That pumps all the drugs around your body and that gets it down. That's certainly what happened to me, as I've explained previously. I kept it down. But it doesn't always go to plan. I had a blood test for a stroke. Waiting patiently. A blood test for a stroke a few weeks ago, no, last week. And I thought I'd go online to look at my results. And they were fine. They no action necessary. But underneath that was the results of PSA tests. I mean, I didn't know they were doing a PSA test. I've got one booked in a month's time, and I said to her, I'll be coming back in a month's time. So why they did it then, I don't know, but they did. And in the box is doctor to consult patient. And I looked at it and it had gone up again. It was double what it was before, and before it was double what it was previously. Still not a lot, but it is doubling. It's not going in the right direction. And so all the things that I was told by Mr. Schaffer do go through your mind. You can't help it really. So yesterday, last night, wasn't a good night. My wife was deeply upset. We just had a good day in Norwich walking around, and it was sunny. We came away, we had a normal day, normal life, and then it all gets shattered again in the evening with an abrupt jolt. That's the way it is. And we had a chat again, and we've decided we'll continue as we go. We won't talk about it necessarily. I don't want to bring it up every day and moan about it and groan. We just get on with our lives and do what we want to do. But I have got an appointment with the doctor today, and we'll see whether I go back on the drugs or not. So I don't know, we'll see. So it's not all wonderful. There's been a bang, look. Rupert's a bit frightened. His tail's between his legs. You wouldn't believe, he was trained as a gun dog, and he was fine as a gun dog until he walked next to a bird scarer, made him jump, and he went into an electric fence. I shouldn't laugh, it was awful, dear. So he's been a bit jumpy ever since, poor lad.